everybody sees what's happening when he smiles. He stretches the lips, he inverts them a little bit, et relaxé. And so we need volume along the whole lower lip. I think we need a bit of contour because the lips are a little bit wrinkled here. I think that this lateral triangle of the lower lip is very important to address in him because he really wants a lot of volume. So we're going to do the contour, we're going to work with the triangle, and then I'm going to do volume here with the point technique. That way you will see many different techniques. And then for the upper lip, we're going to do the perpendicular because we really want to mold and stretch the upper lip so that it rolls out very nicely. But we'll start with the lower lip. So I start with a very straightforward, typical contour. I work with the needle here. I think this is a patient who can sustain pain very well because he's willing to do anything to get big lips, I hope. Okay. And you see, even though it's a Restylane volume, I do a very thin, very superficial contour. You can see a certain amount of blanching here. It's not dangerous. You can do blanching easily. I also try to prepare the treatment so that it shouldn't be too painful, which means that the next injection I do in the area where I already have a small amount of Restylane that's been anesthetizing the border. That way, if I have like 5 injections along a lower lip, it's only the first one that hurts a lot when I go through unanesthetized area. But for every new point of entry, I will actually do an entry where I already have some lidocaine. And that matters for the patients, that's for sure. And here you can see I go for blanching also on this end. Now, I want to address the triangle here, and I do that submucosal with a fanning technique. Thin, nice lines, making a triangle of volume here. Ça va? Bon. C'est très crochu, c'est bon. So now I'm going to do the same thing on the other side with the slight fanning of the lateral triangle. And this is a good presentation of the linear and fanning technique, I think. When I try to make a pair of lips bigger, I often like to work with the lateral triangle here because it really rolls out the lip from the interior and it gives a better definition. And I can see that I lack a little bit of material in the contour right here, so I will take care of that right now. Very superficial because of this definition thing. And then I'm going to go for the point technique for the lower lip just to demonstrate it. I go upwards, I go deep into the muscle, I inject material until I see the lower lip coming up, plumbing, giving some rounding to this sofa effect. Big one there, and the same thing on the other side. And this is an intramuscular injection where I really inject, kan du ta bort den lite? I really inject till I get the shape that I want. I don't know if you can see this, but ouvrez la bouche un petit peu. But with this, I have shaped volume at the lateral triangles, and then I increase the volume here and here so that the most pronounced volume is in these two areas. But we've given quite a bit of volume all along. While I'm waiting for the next syringe, I'm not used to having such expert help all the time. I usually have to do everything myself, but today I can just wait. Just a little bit of recover cream on the lips to see what it looks like and to touch it. And now we're going to start working on the upper lip, and that's a little bit more difficult because here we really want to show more of the lip than we do, and also this area is a little bit flat. I want it to be more curved. Ça pique un peu. I will start somewhere in the middle here, and I will really follow the lip. You see I can follow the curve of the lip. Now my syringe is at the border of the dry and wet mucosa, and I start injecting a rather thin linear injection all along up until the vermilion border, and I put a little bit extra right where the border is at to get some border effect. And then before pulling out the needle, I wait for a second or two. That way, I usually get less bleeding. Så pick and put. And you can see how I follow the curve of the lip with the needle. I go at exactly the same depth from the mucosa all along the way. You have to have the same exact depth all the way if you're going to shape the lips. Ça va? Bon. And this time you're going to think of how to build ships, right? With the segments, you know. Ça pique. Ça pique. And this is where I really want to do some massaging, trying to smooth out the material and get it to spread out under the mucosa, the dry mucosa. New needle?
So it depends also the background of the patient. So I think that you have to understand the patient in a more complex way.
Ça va?
Will you try to create some tubercle in the upper lip?
That's what I'm doing right now. And you can see I go from the side and I go right into the middle. And I make a big drop there to create the tubercle, actually. I don't like to inject right in the middle of the philtrum unless it's really necessary, like on my nurse, because it hurts so much more if you inject through the midline. You have much less sensitivity here than here. If you've ever had an injection right in the middle there, you know how painful it is. Now, if you inject as much material as we do here, you will always see a little bit of a shine-through effect, and you will definitely palpate the material to some extent. And that's one of the reasons why I do like to do massaging at the time of treatment, because I really want the patient to come home with lips that are as smooth and soft as possible. And you can see that there is a lot more visible of the red of the lip, especially on the sides here. And when you open the mouth, you can see that we have created a lot of curves on the lower lip, but now we need more volume on the lower lip to balance the upper lip now that it's more visible. And I'm going to inject longitudinally with Lip Refresh to remove all those fine wrinkles that we have on the sides here and here. But you can see in these two areas where I had the point technique, I've actually stretched out enough so that the wrinkles are gone. But we're also going to put some Lip Refresh on the whole lower lip to remove the wrinkles. Okay? And this one is more superficial than the volume. And you can see that it floats out very nicely in the lip. I think you can see that already when I am injecting, can't you?
Yes.
Just checking with the finger a little bit, and smooth. Now here I like actually to try to make more injections through fewer holes. So I make one straight linear and one oblique. That way I get only half as many injection holes as I would have needed otherwise. And you see the smile. I always make my patients smile because that's a quality control. Any small irregularities will be shown when you smile. So that's really important to do that. Vous avez réussi l'autre fois?
Oui.
Oh, bon. Est-ce que je suis un docteur timide?
Non.